thank you so much for tuning in to KBTV. I'm Dr. Karlisha Booze. It's the month of May, which is also known as Stroke Awareness Month. Stroke is the #2 cause of death in the U.S., and according to the American Stroke Association, about every 40 seconds, someone in the U.S. has a stroke. And today we're talking to Tracy Gibb. She's actually the recreation therapist at Piedmont Macon, and she's going to talk more about bringing awareness to stroke and many treatment options. So thank you so much, Tracy, for joining us.
Thank you. I'm happy to be here. Thank you.
Thank you. So Tracy, just dive right into it. What are some of the, let's start with symptoms. What are some symptoms people have when they're, triggered by possibly having a stroke?
Okay, well, sometimes you will notice some confusion. You might notice weakness in the arms. You might notice loss of balance. You might notice difficulty getting your words out, even double vision, drooping face. Those are all symptoms. Sometimes it's also fatigue. So a person will feel weak and feel fatigued and feel like they just need to lay down and rest. And that is not a good thing to do. Sometimes we've even had an episode where someone was texting someone and the texting was gibberish, and the person receiving the text realized something was wrong with that person, and that person was having a stroke. So there's just a huge variety of things, but most people will say, oh, I just don't feel good. Oh, this weakness will go away. But it's not a good thing to do that. If you're showing any of those symptoms, you should call 911.
Right. Now that's terrible. But the good thing about it, there are treatment options. And I know Piedmont Macon have different programs in place to help people, just get back to their normal lives. Can you talk about that, Tracy?
Yes. So, as soon as you realize you're having the stroke and you get to the ER, there are certain medications, there are certain procedures and processes. Once you've gotten through the medical aspects of your care, then the very most important thing to do is to get to rehab. Piedmont Macon is a level 3 rehab. And what that means is our patients get started immediately with 3 hours of therapy a day, at least, from physical therapy, occupational therapy, speech therapy, and my therapy, recreation therapy. And the sooner a person gets started with their therapy, which means moving, getting up from lying down to sitting, sitting to standing, all of those processes, toileting, bathing, dressing, we have to begin those things immediately so that the brain can begin to make those new pathways around the damaged area of the brain from the stroke.
Right. Now, Tracy, there may be some viewers out there who may not be familiar with recreation therapy. Just briefly talk about that and some of the things that you guys are doing just to help patients.
Okay. Well, once physical therapy, occupational therapy, and speech therapy does their evaluations, I also am doing an evaluation to find out what a patient does. What did that person do before their stroke? And our job in rehab is not only for a patient to be able to bathe, dress, and walk, which of course those are necessities, but also to get back into life. And that's where it takes all of us, but recreation definitely focuses on getting a person back out into the open environment, doing the things the person was doing before their stroke. But I can't do it without PT, OT, and speech, because I take all of those and put it together and help that person get back into doing the things they really love to do. And that's what recreation does. So I can do anything that PT, OT, and speech does in cooperation with them. And so when I take patients outdoors, you might see gardening behind me. If a person gardened, I garden with that person. You can use it as an intervention, but also you want them to continue it when they get home. Does that make sense? So
yeah,
I do all my activities as an intervention, but I'm not going to garden with someone who does not garden.
Nice.
But I am going to pull out my fishing pole with a patient who fishes, and we're going to figure out what's the best way, and we're going to train the family so that the person can get back doing the things. We don't want someone to go home and just sit until they're better, because that doesn't work that way.
Right.
Yeah.
Now, one of the things we want to make sure that people are aware of as we spread awareness here in the month of May is to be fast. Let's talk about that acronym real quick. What does that be fast stand for?
We're going to use this handy dandy thing. Okay. So B is for balance. So if someone loses their balance, that's one of the things, because these are the symptoms. So balance, your eyes, if you're seeing double vision, if you can't see at all, or if you're just seeing out of one side of your both eyes, you're only seeing one eye. Your face, if you have an uneven smile or a drooping side of the face. A is for arm. And if you hold your arms up and one will drift down, that's a sign that something is up. The S, speech, garbled speech, confusion, not being able to get any words out, or when you do speak the words, they don't make sense. And then the final one, they're all important, but T for time. So you don't go lay down. You don't go and just wait and see. You know, you call 911. In fact, it's better to call 911 than it is to drive to the ER. Many people try to drive, or they'll get a family member to take them, but it's much smarter to dial 911. So be fast. Balance, eyes, face, arms, speech, and time.
Nice. All right. Before we go, Tracy, I do know that you guys have the annual stroke stroll that's happening this month. So can you give us all of the details real quick?
Yes, because May is National Stroke Awareness Month. We have a nice stroke stroll, and that's where we invite the whole community to come so that we can celebrate that each person is a stroke survivor. But then we're also trying to increase awareness. And so we have a stroke stroll, which is a nice, fun walk, stroll, roll through the gym. Well, excuse me, through the cafeteria, because we will be in the first floor cafeteria at 12 noon. And we stroll through, we hug, we have high fives. We are celebrating life. And that's what we're doing. We celebrate life, celebrate being a survivor. And then as soon as the stroll is over, we go right over to our meeting area right there. And we have a meeting from 1 to 2:30, which is our stroke support group meeting. But we just wind it all together with our stroke stroll. And this year we're going to be playing Jeopardy. And so we have a cool Jeopardy, and we will divide into teams and have a really great time and have socialization, fellowship, uplifting, and healthy snacks.
Okay. All right, Tracy, good things happening at Piedmont Macon. Thank you so much for coming on the show. And again, you guys, that annual stroke stroll is May 16th at noon. Make sure you get there and just help us continue spreading awareness of stroke.
It's What's Happening Weekend on KBTV, and this is your boy Country Wayne.
Hey everybody, this is Tamala Man, and I'm rolling with KBTV.
Hey everybody, my girl Tamar Braxton, all the way live on KBTV.
Yours truly, Atlanta's own MC Lifer, and I want to let you know I'm all the way live with Carly B TV. That way, the long way. I'm always Carly B TV. Peace up and A-Town down.
Yo, this is Henry Wells, the most feared man in comedy. Street T, all the way live on Carly B TV. I'm here, baby. Check them out.
Yo, what's up? I'm Tony Terry, all the way live on Carly B TV. You heard me?
Poker Bear, all the way live. We'll call it BTV, you understand me? You gonna learn today, babe.